Hi, my name's Amanda Thomas. I'm a community matron working for Halton and Helens Primary Care Trust. I've been using telehealth for approximately the past 12 months. I found the experience to be really beneficial in terms of my clinical practice. To start off with, I had quite a few reservations about it, thinking that perhaps it would increase my workload and increase dependency within my patients. But what I've actually found is the exact opposite. I found that telehealth has alerted me to when patients need me more so than when they don't need me. For example, with my heart failure patients, it picks up really well if they've had a weight gain and alerts me to the fact so that I can get out quickly. Examples include patients with heart failure who have been quite reluctant to call me out when their symptoms have changed. Telehealth has alerted me to that fact with regards to their weight increase, and I've been able to go out and deal with it promptly, which I'm absolutely certain has resulted in a hospital admission being avoided. An unexpected added benefit that we found is the relationship between the staff at Sefton Careline and the patients, because they get a daily telephone call from Sefton Careline. Jo, the lady that runs it, has formed very good relationships with the patients, and the anxiety levels in regards to their long-term conditions have diminished as a result of having that daily telephone contact.
Hello, my name's Helens and I have brittle asthma. I've been on the telehealth for about 9 months and it's just absolutely changed my life totally. It just gives you confidence and reassurance. Before that, I was in 2007, the last emergency admission I had, I was on life support and ended up with tracheotomy. And before that, in the couple of years before that, I was in emergency 7 or 8 times. And it just reached a point where it was just ridiculous. So Dr. Gibbons referred me to a community matron, through which I've been introduced to telehealth. And I have had one admission to hospital in the last over 2 years. And that was when I actually smilingly say I walked into hospital. I wasn't taking it unconscious. I've been on it for about 9 months now and it's totally changed my life. I've got absolute confidence because by using it I can recognise when the levels are maybe down a bit myself, and telehealth actually highlight it and get in touch with me, and then consequently get in touch with the community matron, and then they come back to me and it's all instant, it's all immediate, and you don't have to wait to go see a doctor, you don't have to ring the doctor, you don't have to get into that panic of ringing an ambulance and then going in as an emergency. All this information is purely to pick up your blood pressure, your pulse rate, your SpO2, your temperature. Even your temperature is good because if it highlights, it could mean the beginning of a chest infection and nip it in the bud. So you get your antibiotics or your steroids now, instead of having to go through the doctors for appointments or even going into hospital. And it's such a reassurance. And I mean, I'm just a different person because I just felt like I was hitting a brick wall before. I'd nowhere to go, and telehealth has just literally opened up my life.
My name's Colin, COPD and asthma, worked on the call for a number of years, took ill then with my asthma and then it went worse, then I was classified with COPD. It was a terrible thing, I didn't think I'd ever be ill, and my family, they've been very good to me, they've looked after me with my illness. My daughter stayed here 3 months because I was that ill. Oxygen, couldn't get up the stairs. It was murder. It was a bad life I was having. And then I was ended up then introduced with this life, and my life has changed completely. It's like having your own nurse with you. You put confidence in yourself and you don't ail as much because it's there to look after you. I was bad last week, and Jo phoned me up, she asked me what was wrong. I said, I don't feel well. Within 3 hours, the head nurse was here, steroids and antibiotics, and I'm back to normal. No more hospital trips. In 11 months, I've been in once since I've had the telehealth. That's how good this machine is, and I think people that are ill, really ill, should be on it. And without my family, you know, I wouldn't have been here all the time, because it was really ill. As I said, since I had this machine, it is fantastic. But health-wise, I didn't give much up for my own health. You know, if it had took me, I'd have accepted it. You know, but since there, I've had this machine, like, it's been fantastic.
Right, my name is Bob, and I was introduced to telehealth by the cardiac nurse, Colin. And it's been a marvellous thing for us to do, because it saves us keep going to the doctors all the time, and Karen liaises with the doctor. Every time she comes or phones me, she liaises with the doctor, and the doctor gives her the instructions what to do now, what tablets to have. And so it's a marvellous thing for me, this telehealth. So, and before, we had to go to the doctors like quite regularly. More often than not, it was a hell of a walk. It's only up to the top of the street, but I just can't walk that far, you know. So she just came with this idea, and we said yes, and it's been marvellous to them.
My name is Anne. I'm Bob's wife of 53 years. Life has been a lot easier since this, and a peace of mind. I mean, I wouldn't have known what to do if, let's say, his blood pressure was high or low, but now I don't have to bother, because it comes over they ring back and say, you know, his blood pressure is a bit too high this morning or a bit too low, do it again, and that's what we do. And if it was still low or still high or whatever, I'm sure something would be done from that end. I mean, no, it was low this morning, and no doubt Karen the nurse will ring back sometime this afternoon if she doesn't call. I mean, obviously she's very busy and she's loads of patients, but she will contact us, or someone from her office will contact us, or she'll contact the doctor, which she's done on numerous occasions, to get things, you know, is this all right or that, or have you got anything that Bob could take, you know, which is priceless.